Good morning, Chair Card and members of the Council. Thank you for the opportunity to provide a public health update on COVID-19. My name is Dr. Deepika Lobo, and I'm an Associate Medical Officer of Health. Today, I will share an update on our local public health surveillance data, including variants of concern. Dr. Joanna Oda, our other Associate Medical Officer of Health, will provide an update on the status of the COVID-19 vaccine rollout in Halton, followed by Jane McCaskill's presentation as well. Next slide, please. So this slide shows COVID-19 cases in Halton. As of April 19th, Halton has seen over 13,000 cases of COVID-19. This includes over 1,000 cases that are active right now, and sadly, 206 deaths. This graph shows the number of new cases per day, broken down by whether they are known to be variant cases, which is shown in green, or non-variant cases, which is shown in gray. Please note the orange line, which indicates the most recent days of data, where variant cases are likely to be underestimated because the results of mutation testing are usually not received until several days or more after the case's initial COVID-19 test result. The 7-day rolling average, which is shown in the gray line for non-variant cases and the green line for variant cases, has been surging upwards in recent weeks. We experienced a record number of new cases this past Saturday, April 17, indicated on the graph with a red arrow. That day, 191 new cases among Halton residents were reported, the most ever reported on one day since the pandemic began in March 2020. 2,635 new cases has been reported to our health unit just between April 1st and April 19th this month. This has threatened our public health capacity to manage cases and contacts. Next slide, please. So this slide shows COVID-19 variant cases in Halton. It further demonstrates how the percentage of new cases reported among Halton residents per week that are variant cases has been trending upwards over time. In early January, almost no new cases reported in a week were confirmed or likely to be variant cases. By the week beginning April 4th, this figure has risen to 75%. Please note these estimates are subject to underestimation since not all cases can be tested for mutations, and the estimate of 62% for the most recent week is particularly subject to underestimation as not all recent cases have had the mutation test results available yet. It is clear that as predicted, variants have taken hold in Halton as they have elsewhere in Ontario, and they are driving the strong third wave seen in the previous slide. The majority of variant cases in Halton have the UK variant. Next slide, please. So this slide shows the proportion of new cases on a given day that fit into each age group. So the x-axis represents the total number of cases on a daily basis, and each color within that vertical axis represents the proportion of total cases for that day for each age group. So as we can see on the slide, the share of cases among residents aged 80 plus, which is shown in gray at the top, has declined significantly thanks to the vaccination targeted to this age group. They are now accounting to only about 1% of our new cases. Residents aged 60 to 79 have also seen a similar decline, currently accounting for 12% of new cases. Therefore, the bulk of new cases are concentrated among residents aged 40 to 59, shown in orange, and 20 to 39, shown in blue. And this is around 32-33% of our new cases. Cases in the age group 0 to 9 make up around 20 to 22% of our new cases. Please note that this visual, as well as rates by age and variant status, can now be found updated daily in the new Trends Over Time section or tab on halton.ca dashboard. Next slide, please. So COVID-19 outbreaks in Halton. In a remarkable achievement, there has not been an active outbreak in a Halton long-term care or retirement home, which is shown in green in the graph, since April 2nd, when the last two were declared over. However, we are seeing many new outbreaks declared in other settings, particularly in workplaces. As of April 19th, there were 10 outbreaks active in workplaces, as well as several outbreaks in schools, congregate living facilities, and daycares, with variants are often playing a role. Next slide, please. So this slide shows the number of patients with COVID-19 in Halton hospitals. It is broken down by whether or not they were in the ICU. Just as the third wave has brought us a record number of new cases on a single day, it has also led to a record number of COVID-19 patients in Halton hospitals on a single day, with 134 COVID-19 patients occupying beds in Halton hospitals on April 19. Among those 134 inpatients, 38 or 28% are in the ICU. Overall, this represents a 379% increase in the number of COVID-19 patients in Halton hospitals over the past 30 days. As shown on our dashboard, ICU occupancy across the 4 Halton hospital sites combined is sitting at 100%, and acute care bed occupancy is sitting at 93% as of midnight on April 19. Given the current situation, hospitals across the GTHA and Ontario are helping each other with surge capacity. So it is very likely that non-Halton residents are being treated in Halton hospitals, and some Halton residents are being treated in other GTHA Ontario hospitals. Next slide, please. So the previous slide focused on the occupancy of Halton hospitals for COVID-19 patients. This slide focuses on number of Halton cases, so cases who are Halton residents who went on to be hospitalized and reported that hospitalization to our health unit. So these cases may be hospitalized in a Halton hospital or in a hospital outside of Halton. As you can see, thankfully, the number of new cases among residents aged 80 plus that lead to hospitalization has declined significantly in recent months, and this is shown in gray. The number of cases who went on to be hospitalized is likely to be underestimated, since not all cases provide this information about their hospitalization to us. And some cases reported in April may still go on to be to experience hospitalization, but are not yet hospitalized. Despite this underestimation, as of April 1st, so between April 1st and April 19th, there are already more cases aged 0 to 39 and aged 40 to 79 known to have been hospitalized than in any previous month.